Hi, my name is Falguni Rana, and I'm a community service leader, an artistic director, an ace dance choreographer, and an Indian classical dancer. I want to wish all my family, friends, gurus, and all my supporters and my viewers a very happy Diwali. Diwali means Festival of Lights, which explains my red festive dress today. My guest today is the world-renowned cornea surgeon, Dr. Thomas John. Welcome, Dr. John. It's my absolute honor and privilege to have you on the show. For those of you who do not know, Thomas John is the leading eye surgeon, world-renowned cornea specialist, clinical associate professor at the Loyola University at Chicago, and in private practice in Oak Brook, Oak Lawn, and Tinley Park, Illinois. On September 19th, Dr. John was the only invited speaker from USA at the traditional symposium recognized by the MMA Eye Clinic of the Serbian Society of Cataract and Refractive Surgery at the Military Medical Academy in Belgrade, Serbia. Dr. John, that is quite honorable. Please tell us more about that.
First of all, I want to thank you for inviting me, Fal. It's a pleasure to be here this evening. About 2.5 weeks ago, I, as you mentioned, was invited speaker to attend and participate in the 5th symposium called New Concepts in Ophthalmic Surgery that was held in the famous Military Medical Academy in Belgrade. There were more than 450 ophthalmic surgeons from Serbia and the neighboring countries who attended the symposium. And this symposium covered various aspects of eye care, both medical and surgical eye care. And to focus on what I spoke during that conference, I picked the topic which I think is very exciting because it's a use of placental tissue on the eye. So amniotic membrane is part of the placental tissue. There are two types of membrane in the placenta, which is the amnion and the chorion. Amnion has no blood vessels, but it is the magic tissue because it helps in healing with hardly any scarring or no scarring. So I spoke about the use of this amniotic membrane on the eye to cure, heal various eye diseases, and in the process restore vision to these patients. So that's what I spoke about while I was in Belgrade.
Amazing. While in Serbia, you also met personally Crown Prince Alexander and Crown Princess Catherine at the Royal Palace where a royal function was held. How did it feel to be amongst royalties?
I have to say it's an humbling experience and a very exciting experience and a unique experience. Being in the palace with the prince and princess was truly a unique experience for me, I'm sure for everyone. And during that time, I actually learned that Princess Catherine is involved in various humanitarian activities. She comes to the United States, raises funds to help the handicapped children in Belgrade. This I thought was tremendous. And being in the palace, looking at the palace and learning about the historic background of the palace and the prince and princess was huge for me.
Wow, that is quite remarkable. You received your cornea fellowship at the very prestigious Harvard Medical School, Massachusetts Eye and Ear Infirmary in Boston. It's very creditable, especially as it is very difficult for a foreign student to get admission even today. Tell us your experience and what are your memories?
Do you want to know the truth? The truth is, I give all credit to God. I take no credit. I give all credit absolutely to God, because it is almost impossible. I think I can be hit by lightning more than trying to get into one of the 2 spots that's available in clinical cornea fellowship at Harvard. But playing the tape backwards, even while I was in India, that was my desire, that was my dream, to be at Harvard, to be with leading medical surgeons and ophthalmic specialists. This was an impossible dream. When I actually said this to some of my friends that I want to be at Harvard, they actually laughed at me. And actually I laughed at myself because the chance of that happening is almost impossible. But I believe in God and I trust in Him, and I am so passionate about my dream. So I work hard and leave everything in God's hands. And I'll tell you what, impossible will happen. And that's what happened to me. And it's a fact. I am nobody. I give all credit to God. So while I was there, I was among the world's leading ophthalmic surgeons. While I was at University of Pennsylvania as an ophthalmology resident, I wanted to be at Harvard. Even there, when I mentioned I want to go to Harvard, people laughed at me because, again, for the same reason that I just mentioned. While I was there, the learning experience is beyond expression, because these are unique individuals, amazing individuals. I learned so much that when I came to Chicago and I was the director of cornea service, the skill set that I learned in Boston helped me to deal with various eye diseases.
You were the first physician in Illinois to have performed artificial cornea transplant surgery. Please tell us how an artificial cornea can restore vision in people who are blind.
Very good question. Let me just back off before I talk about artificial cornea. What is a corneal transplant? What is cornea? Cornea, as you know, is the clear window in the front part of the eye. It is through this clear cornea that we see the world around us. We see our loved ones. I look at your beautiful red dress, all because the cornea is clear and I'm able to see. Once the cornea gets cloudy, your vision is no longer clear. So what do we do in those situations? We do a corneal transplant where the cornea is removed and replaced with a clear donor cornea. This restores vision for the individual. However, the body can reject the cornea. In some subset of patients, you can have repeated graft rejections. So therefore, in these individuals, in these subset of individuals, we go on to use plastic or artificial cornea. So when we use an artificial cornea to restore the clarity, much like, for instance, the video cameras or your regular camera, when the lens gets cloudy, no matter how good your you know, the olden cameras, we used to have film, of course now it's digital, but the image will not be good if your lens is not clear. Similarly, in the eye, the cornea is like the lens, so to speak, in a camera, and the film in the older cameras is like the retina in our eye. So when the cornea is cloudy, you cannot see well, your image is cloudy. So we use artificial cornea in the subset of patients to restore clarity and to restore vision so they can again see their loved ones and the world clearly around them.
Wow. You have been invited as a speaker to several countries globally, including Finland, Italy, India, Greece, Serbia, Brazil, and Peru. It's very honorable. Can you give an insight on it?
Well, when one has to travel and also see patients and your daily practice, one has to learn to multitask, be ahead of the games in terms of trying to put your talk together in a timely manner, and you have to really enjoy meeting people. You have to enjoy the interactions of people in different countries from different cultures. It's not just the eyeball and ophthalmology, it's beyond. You meet these people in different countries who are leading in their countries. So it is that kind of desire where you can go and share your own experience, and bilateral learning experience and teaching experience is what one looks for. And so it has been very exciting to visit these different countries and be an invited speaker at their national conferences.
You have written 7 textbooks. How do you find time between your practice, surgeries, traveling, writing all together? Doesn't it get excruciating at times?
Well, it goes back to what we say, passion. If you have the passion for what you want to do, then the body just follows what the mind desires. So when you edit these textbooks, there is a demand on time. So one has to give up something else. You can't play golf and edit the textbook. So I don't play golf. So it's simple as that. It's all about choices and the passion and the desire, and to try and follow your own dream.
You have performed LASIK on celebrities. Can you tell us more about it?
Well, I was fortunate to do PRK, which is a form of refractive surgery like LASIK, on, for instance, a very famous NBA player who I will not mention the name, obviously, for privacy reasons. And you'll see him actually in all the current basketball games that you watch on television. I was pleased to perform this procedure called PRK, where there is no flap. And the reason I chose PRK for him is that when you play basketball, you can have, it's a contact sport, and if there is any contact to the eye, the flap can be dislodged. So therefore, I performed PRK on this famous basketball player, and he's very pleased to report that his vision is very clear and is very pleased with what he has right now after the procedure.
You appeared on the famous Doctor Show, which is shown on TV all over the world. Why do you think you were chosen to appear on the show?
Yeah, it's called the Doctor Show. I'm sure a lot of you have watched the Doctor Show. And I was really happy to have received this telephone call. They said, we want you to talk about DMAC. Now, I was one of the earliest to do DMAC in the state of Illinois, and one of the earliest among few in the country to do DMAC. DMAC is the most advanced form of corneal transplantation. You see, the innermost layer of the cornea is called the endothelium. In certain conditions like Fuchs dystrophy, trauma, etc., the endothelium can dysfunction, will not function properly. What happens then? The cornea becomes cloudy. Instead of doing the traditional corneal transplant where you remove the entire cornea and replace it, like I mentioned, with a donor cornea, you just remove the innermost layer, which is about 12 to 15 micron. So we're talking about thin, like plastic saran wrap, thinner than what you use in your kitchen, for instance. You remove that layer from the patient's eye, and then you manually dissect similar tissue with healthy cells. It will roll like a carpet. You put that into the eye of the patient, unroll it, and then attach it to the inner surface of the patient's cornea with an air bubble. When the cornea heals, these corneas will look like brand new, almost like brand new. And the vision is the best that one can get. So because I was doing DMAC at such an early time, the Doctor Show picked me to talk about this surgical procedure to the audience.
That is incredible, Dr. John. Your series is numerous pages long and still growing. You seem to have achieved a lot. How will you influence today's generation?
You see, today's generation is very important. Our children is the future. It is so important that every one of us pay attention to our children. Now, it's not about me, it's not about you, is not about all the adults, it's not about the older folks. With all due respect, it is the children, because the children are the future. So my advice to them is, you have to follow your dream with passion, listen to your parents, follow what religion that you follow, and work hard, because you're in the greatest country on earth. And this is the only country where you don't have a top, so to speak. The top is open. It's all what you make of your life. So my advice to the future generation is to follow your dream and follow it to the ultimate.
Your mother and father seem to be way ahead of times, and they were both eye surgeons. You truly had an extraordinary beginning. What are your other interests other than giving people the gift of sight?
Well, I always looked at ophthalmology as just one subject in my report card. I feel that life has got many facets, and one has to pay attention to these different facets. So even during my training, I told myself that I am not going to commit myself all to just one area. So I focused on music. I'm a rock and roll drummer. In fact, believe it or not, a band played at the Universal Studios this May. We played for 3 hours. It's a very unique experience to have the opportunity to play at the Universal Studios on their in their main auditorium. So music is part of my interest, and I even today go for drum lesson. And my drum teacher Kevin, I tell him he's one of the best in the world. He teaches me phenomenal rhythm. So music. The other area that I like is dancing. I do line, disco, ballroom dancing, and every time I'm on the floor with my wife, I'll get compliments saying that you're the best dancer, you're the best dancing couple on the floor. But dancing is like how you unite with the sound, the music. And when you dance, it's a union between your body and music. So you have to have various interests. So my interest is kind of diverse. So there's eyeballs, there's dancing, and there's rock and roll drumming.
I see you are always dressed immaculately and have a great sense of style. Do you have a hero you follow or any fashion icon?
Well, I had to first say that, like I said earlier in this interview, I consider myself as nobody. My true hero is God. I give all credit to God. I'm nobody. Having said that, in our day-to-day life, so to speak, I feel that you have 10 seconds to make an impression on another individual. Also, it is our duty, I think, how we present ourselves. In the 10 seconds, if you don't connect, then that's it. All bets are off. So I feel that you have to pay attention to the clothing that you wrap around. And that's the reason when I go to church every Sunday, I want to make sure that I'm dressed well to go to God's house.
What do you see the field of eye surgery heading towards? The future?
Excellent question. The future is very exciting. Ophthalmic field is just going to take off in various directions. The integration of laser technology for cataract surgery, more refinements in refractive surgery, highly advanced intraocular lenses that can possibly be even injected into the lens capsule, use of amniotic membrane in the form of a fluid instead of the tissue, injecting cells into the front part of the eye to line the inner dome of the cornea and restore vision. It is truly an exciting time, and the future looks so bright. I think we are so glad to look at the future because, as we all know, one of God's greatest gifts is the gift of sight.
Thank you so much, Dr. John, for your valuable time and being on our show.
Thank you, Val. It's an honor to be here.